Today for this very special webinar. Today's session is being hosted by Royal Columbian Hospital Foundation, and my name is Linda Morgan. I'm privileged to be part of the team here at the foundation, and the foundation exists to build public support to advance the mission of Royal Columbian Hospital. Royal Columbian Hospital is the only hospital in the province with cardiac, trauma, neurosciences, high-risk maternity, and NICU all on one site, which means that RCH sees 1 in 3 people in British Columbia for critical care. Before we dive into this really important topic, I'd like to begin by acknowledging that Royal Columbian Hospital and the Foundation are located on the traditional, ancestral, and unceded shared territories of the Kwantlen and Kikite First Nations, and home to the North Fraser Métis Association. On a personal note, my family moved to this area in 2021, and I am grateful to live, work, and play on this land. So today we are so fortunate to hear from Dr. Brian Yang, who is going to share not only the future of robotic surgery, but also what strides we are already taking here at RCH. Please note that our Q&A function has been enabled, so please do type in your questions as Dr. Yang is sharing, as we will have dedicated time for Q&A a little later. So now let me introduce you to our special speaker. Dr. Brian Yang is a distinguished figure in the field of urology, currently serving as the head of urology at Fraser Health and holding the esteemed position of head of surgery at Royal Columbian Hospital. Hailing from Vancouver, Dr. Yang pursued his medical education at the University of British Columbia before completing his residency training in Hamilton, Ontario. Throughout his career, Dr. Yang has been a vocal advocate for advancing surgical techniques, particularly in the realm of minimally invasive surgery. His passion for innovation led him to champion the establishment of a robotics program at Royal Columbian Hospital, despite initial obstacles. With perseverance and the support of key stakeholders, including Cindy Lokinen and Dr. Dave Conkin, Dr. Yang's vision gradually gained traction. Today, Dr. Yang's efforts have borne fruit, as the robotics program at Royal Columbian Hospital stands as a testament to his commitment to excellence in surgical care. By embracing cutting-edge technology and fostering the development of young talent, Dr. Yang is paving the way for a future where patients in New Westminster and Fraser Health can receive the highest standard of treatment. As Dr. Yang looks ahead, he sees the robotics program not only as a professional milestone, but also as a legacy of innovation that will shape surgical care for generations to come. Through webinars and other educational platforms, Dr. Yang continues to share his expertise and passion for advancing the field of urology, inspiring colleagues and patients alike to embrace the possibilities of the robotics era in healthcare. So Dr. Yang, welcome. Thank you so much for taking the time to be here today. We are so excited. We have a number of folks from all across the province who are joining us this morning. So over to you.
Thank you, Linda. And I wanted to first thank the Foundation for this opportunity to discuss our innovations with everybody who came today. And I thank all the people that are online with us. Looking at the names, I see some of our current former colleagues, some of my patients, some of the board members of at the foundation as well. And I do appreciate everyone for showing up. My time is your time for the next 45 minutes. The foundation, as everyone knows, does so much for us as a hospital, and also for our patient population in the New West Tri-Cities area, as well as all across the Lower Mainland. We are the level 3 trauma center, level 1 tertiary trauma center, and so many of our regional programs, such as neurosurgery, high-risk obstetrics, cardiac surgery, are all housed at the Royal Columbian Hospital. The best thing about I've been here for the last 15 years or so is everybody's dedication and passion to being able to provide beyond standard of care, excellence in care for all of our patients that show up at our door. And I'm very proud to be part of this hospital. I'm very proud to be a leader in this hospital. So thank you for that wonderful introduction. We can start. Well, today we're discussing the robotics program that I've been working on literally for almost 10 years. But it's only within the past year and a half or so that it has really gained traction. And with our redevelopment and with support from the foundation, boy, it's become a reality, and we're really looking forward to it and very excited about it. Next slide, please. So this is a slide put together by Dr. Nathan Wong, who is one of my junior colleagues. He just wanted to express that over the last 15 years, urology has very advanced a lot at the Royal Columbian Hospital. We came from very rudimentary abilities to do open surgery to laparoscopic surgery. We're using all the top-notch flexible cystoscopes, and in the middle there, this was the foundation in 2012. They helped me and help our population purchase a green light laser for BPH treatment. And so currently the next step is the robotics program, and innovation and cutting edge technology has always been in the forefront of our practice here at the Columbian. Next slide. So back in the bad old days, all radical prostatectomies for prostate cancer were done with an open approach, and we are going to use radical prostatectomy as our index kind of surgery for robotics, because it has been proven time and again to be done way better, minimally invasive than the old open approach. The open approach has been around since the 80s, and the visualization was horrible. The bleeding was significant, and the functional outcomes, including things such as erections and leakage after the surgery, were severe. In 2010, when I came to the Columbian, I was able to bring along skills that I learned at McMaster, and we were able to do a laparoscopic approach to prostatectomy, which improved all of these parameters significantly. Next slide, please. So when we do a radical prostatectomy, we have to be very careful not to breach the prostate, because the cancer is in the prostate. Also, you see those two yellow things at each side of the prostate. Those are graphic representations of the nerve bundles that control your erections. Those have to be carefully stripped off the prostate, and massive blood vessels around the prostate that we have to control, or else the patient will literally bleed to death. And that was not an uncommon occurrence when this surgery first started with open surgery. The visualization, getting deep down in the pelvis to take out this organ that God probably never intended to be taken out anyways, but when it's given you troubles and it's causing cancer, we had to dig down deep into the pelvis, couldn't see anything, and the results invariably were not very good. Once we take the prostate off of the bladder, we cut the prostate off the urethra, then we have to sew the bladder back down to the urethra now that the prostate is gone. And in the images, the 6 graphic images on the right side of your screen, it shows how we use sutures, stitches, and needles to sew the urethra to the bladder. And that is a very delicate part of our surgery. Again, when you're doing it open, you cannot see what you're doing. It's way deep down in the pelvis. This is best to be done with a camera or your eyeball straight in the pelvis, and that's what laparoscopic and robotic surgery allows us to do. Next slide, please. So with laparoscopic surgery, we were able to do smaller incisions. So instead of 1 large incisions, we have 5 poke hole incisions through which we can put our camera as well as our instruments. Pain was much better. Recovery time was better. Blood loss was significantly less. Blood transfusion rates went down significantly, and we allowed shorter hospital stays. Next slide, please. However, laparoscopic surgery is a very challenging surgery to learn and to teach. So in a high volume center that I trained in Hamilton, we were able to do hundreds and hundreds of these surgeries during our residency, and only then were we safe to come out and do this surgery. This technique of using straight chopsticks straight into the pelvis to dissect off nerves and do very delicate maneuvers. Uh, this is probably still one of the most challenging surgeries in all of surgery to do. The functional outcomes that I mentioned earlier, such as leakage and erections, have to be kept in mind, as well as our oncologic or cancer outcomes, like making sure we get all the cancer out. Everything has to be balanced. Next slide, please. In fact, some of the studies showed that you need to do about 400 to 750 of these cases laparoscopically in order for you to feel comfortable doing this on your first patient. And so this obviously is very intensive training, each surgery probably lasting anywhere between 3 to 5 hours. This is a lot of time put towards learning a craft and perfecting a craft. But obviously, when we're talking about people, our patients in cancer, it is well worth it. And we put in the time to do this and learn it for the betterment of everybody who we treat. Having said that, with the advent of robotics, this has changed the entire landscape of minimally invasive surgery for things such as radical prostatectomy. Next page, or next slide. Robotics allows a surgeon to sit at a console and guide the instruments. Now, a lot of people think that we just turn on the robots and the robot will do all the surgery. That's not how the robotics works in surgery. The surgeon has to sit at a console, and you either put your head in, depending on which robot you buy, you put your head into these goggles, or you wear these goggles, as this surgeon is doing, and you are able to control the arm movements of the robot inside this patient's body. So basically, you're allowed to have very intricate movements with the robot controlling the instruments, but you controlling the robot. It's much easier to control those instruments inside the body. Now, these minute movements, the irony of being a surgeon is that as you get more experienced, you learn more about how the body works. You've done hundreds and hundreds and even thousands of these surgeries. That's when your eyes and your hands start to go, right? And as the surgeons, as we age, our ability to better to judge depth perception, to be able to see clearly what we're doing, and ability to hold our instrument steady starts to go a little bit as we get older. Now, the robot accommodates all of this stuff for us. It steadies our hand. The visualization is next to better than anything in the world. In fact, the robot allows us to see 3D visualization in the body. Current laparoscopic techniques is only 2D visualization on the TV. So this allows us, our surgeons, to be able to perform much more accurate movements within the body itself. Next slide. So robotics, as we put our head into the console and we stick these instruments into the patient's body, the other thing that it allows us to do is each of these instruments have a articulating wrist inside the body. So it allows us to reach around corners and to dissect out things that would have been very difficult with a very straight instrument. And this allows infinite degrees of motion within the patient's body, and it allows a much more intricate dissection. Especially, I see huge amount of advantages in robotics and ENT surgery, where they have to do neck dissections. They can go through the mouth and be able to get around these very, very sensitive nerves and blood vessels that run in the neck. Obviously in the pelvis, when we do our prostatectomy, this allows us to reach around the prostate to release tissue and release nerves. It basically allows us infinite degrees of freedom within the body itself. It basically allows us to stick microscopic hands into the body and operate, instead of having to operate through stiff chopsticks. Next one. So there have been multiple studies that show that robotic and laparoscopic surgery have been superior to open surgery. And so, I mean, this is just a list of some of the studies, color coded, but it has proven to be better. Next slide, please. The studies have also shown that to learn how to do a robotic prostatectomy, the same surgery that took me 300 to 400 cases before I felt comfortable doing, it takes probably about 50, between 20 to 50 cases, depending on your experience with laparoscopic surgery beforehand. So the learning curve all of a sudden went from something that was extremely difficult and required an immense amount of time and years to learn to something that somebody could pick up and learn within half a year and become an expert at within half a year. So you can imagine how within the past 15, 20 years, as the robot came out and become more prevalent all across the States and all across the world, laparoscopic prostatectomy has fallen to the wayside. There's not one program in the States that still really concentrates on laparoscopic prostatectomy. In Canada, again, very few of the programs across the country teach laparoscopic prostatectomy. Everybody is learning robotic prostatectomies. But the irony of it is the robots are not available in 95% of hospitals within Canada. So you learn how to do this robotically, but you end up working in Prince George or Eagle Ridge or Kelowna General, and there's no robot. There's no robot in any of these hospitals. In fact, there's only one robot in one hospital right now in BC and has been so for the last 15 years, and that's Vancouver General Hospital. That's the only robot. Next slide, please. Oh, so this is my boy. This is my son. He's 15 years old. I brought him along to take a look at the new Medtronic robot when they were advertising it. And we went to UBC, and he was allowed to play on this $4 million amazing piece of equipment. And this instrument, within about 10 minutes, he was able to pick up rings and put it over poles and play with those jacks and put it in the rings. It's just that intuitive. A 15-year-old kid who's never done surgery in his life was able to pick it up within 15, 20 minutes. All right, so next slide. So, robotic, how to teach robotics has been a huge amount, a lot of energy has been put into how to teach robotic surgery. And we are, as surgeons, we are sent away to various different places that have robotic setups for training. And we first work on plastic models, as you would imagine. Our first patient is not a live human patient who has cancer. And we have all sorts of models to teach us how to properly operate. Dr. Wong, who we hired last year, he's a robotics expert, and he has put a lot of energy and studies into how to properly teach robotics and come up with all sorts of 3D models. And we're obviously very excited to have Nathan with us. Next slide. We have virtual reality type setups as well. The picture earlier was showing my son Isaiah playing with a virtual reality with rings and jacks, and this really helps us. And I've had quite a lot of chances. In fact, recently I was in Paris for a robotics course. Quite a lot of chance to play with these things, and again, they're fairly intuitive, but obviously the more you practice, the better you get at it. Okay, next slide, please. So next slide, this is basically the same information. Now, the great thing about robotics, and one of the reasons why we have to jump on board now, is as artificial intelligence takes over the world, including the surgical world, there are many technologies that will be built into the robot to allow us to make better decisions of how wide to go on our surgical margins. There'll be visualization tools where we can inject a fluorescent dye into a patient's vein, and that will light up the tumor so that we can know that we can get the whole tumor instead of leaving a corner of it behind. Artificial intelligence will be able to help us take a look at a patient's CT scan or MRI and translate that into our real-time dissection and guide us in terms of how we do this, right? So we need to get on board so we can develop with the robot in this very exciting time, so we can provide the best of all care for our patients. If we wait another 5 years even, we'll definitely be behind the ball. Next slide, please. So artificial intelligence can assist surgeons in a number of ways to improve surgical outcomes. For example, AI algorithms can help identify abnormalities or potential complications during surgery by analyzing real-time data from sensors and imaging devices. This can help surgeons make more informed decisions during the procedure. Additionally, AI can assist with preoperative planning by analyzing medical images and providing accurate and detailed maps of the surgical area. AI can also help with postoperative care by analyzing patients' data and providing insights into potential complications and effectiveness of different treatments. Overall, AI has the potential to revolutionize surgery and improve patient outcomes. This whole paragraph was synthesized by ChatGPT, so it was AI patting itself on the back, but it's very, very true. Next one, please. So I've been talking a lot about urology because that's what I know. I'm a urologist, and but AI, the robotic surgery is being applied across many surgical specialties. In Royal Columbian Hospital, in particular, our general surgeons, especially our colorectal surgeons, are very interested. Our gynecologists are very interested. And cardiac surgery has also thrown their hat into the ring as well. But robotic surgery is very much developing across all fields, and it's not just urology. We're bringing this instrument in for all surgeons to use in the future. Now, we don't have head and neck surgery or thoracic surgery at the Royal Columbian Hospital. Those two disciplines are performed mostly at Surrey Memorial Hospital, and the Surrey Memorial Hospital will be getting a concurrent robot with us at the same time, and that robot will be mostly run by the head and neck surgeons and the thoracic surgeons to do those type of surgeries there. So we're hoping that all of Fraser Health will be covered. In fact, it is my secret hope that if the program runs well and is successful in these two sites, in the future, most of the larger hospitals in Fraser Health will have a robot to assist with surgery. Next slide, please. Again, so we talked about cardiac surgery. They've done a few things robotically as well. Colorectal surgery, that's a big one, because to get up into the colon from below to do surgery, again, that's a very difficult place to operate on from within a colon. With a robot, the arms can articulate within the colon and provide amazing surgical results. Gynecologic surgery, thoracic surgery, head and neck, I see huge benefits in head and neck surgery. Right now, when they do their neck dissections for lymph nodes for head and neck cancers, it's extremely morbid. They basically have to open their entire face to do the surgery. But in the future, with robotics, they can go through the mouth and provide a minimal dissection on the outside, and the results will be not just cosmetically better, but they'll be able to get better results because they'll be able to see better. Next slide, please. So as I mentioned before, there are very few programs, in fact, no programs I can think off the top of my head other than the residents we train who will learn how to do laparoscopic prostatectomies anymore. And we have several robots within Ontario and Quebec area. We have one in the Maritimes. We have two in Alberta. And we have one in BC, and that's it. That's all we have across Canada. And so, like I said, 98% of hospitals in Canada do not have access to the robot. Next slide, please. So there are many reasons why we need robotics in our operating room. We mentioned earlier a few of them. All our trainees are coming out not trained in laparoscopic prostatectomies and some of these complex laparoscopic surgery. It'll allow surgeons to extend our operating capabilities into the years where maybe our eyes and our hands are starting to go a little bit, but our knowledge and our judgment is at its peak. We will allow development into the AI era of surgery, which is important for us to do, and allow us to attract the best and the brightest of all the surgeons that are trained across North America and the world. Next slide, please. So we're not quite at June yet, but June is Men's Health Month, and as men, we tend to often ignore our health. We tend not to see doctors very often. We tend to do high-risk behaviors like smoking and drinking. We're much less likely to seek routine checkups if we feel fine, as opposed to the smarter lady counterparts that we have. In men, mental illness is a silent epidemic for everyone, but even more so for men. A lot of men suffer in silence with mental health issues. I just want to put out a plug and just remind all the men and all the ladies out there to remind their male friends that to go get checked. Next slide, please. And to end off this presentation, I just wanted once again to thank everyone for joining today and listening so attentively. I really appreciate it. I really want to thank the foundation, Linda and Jeff and the whole foundation for your support and help, and also to Fraser Health executive and leadership, without who my vision that I started thinking about 10 plus years ago when come to fruition. And really, I'm so excited because with this, we'll launch Fraser Health into the robotics era, which is truly the future of surgery. And with that, we'll develop the artificial intelligence era, and we'll continue to be able to provide the best of all care for our population. Thank you very much.
Thank you so much, Dr. Yang, for just sharing this really exciting information with us. And we're not in the same room on this call right now, but I can feel sort of the passion through the screen, and can just imagine the number of hours and energy and heart that you and your colleagues have poured into the last decade of really bringing this forward. So thank you for your vision. Thank you for your leadership. And it's really going to benefit all of us across our region. So now this takes us to our Q&A. Let's see what we have coming in. First question is, when will we be getting this equipment at RCH?
Yeah, so we current footprint of our operating rooms, we're maxed out. I'm sure you guys all know that our hospital right now, as it stands, is too small for our population. And so to add an extra robotics room, we can't do it. It's just every single operating room is being used every single day. Adding in a robotics room it's just not tenable. So with our increased footprint in the redevelopment of our Jimmy Pattison acute care tower, everybody can see it behind the hospital. It's almost there. So we anticipate that tower will open up in fall of 2025. And with that, the robotics program will start.
Great, thank you. Looking forward to that. And please stay tuned for more information from the foundation as we look forward to that exciting occasion. Next question, are the results better than laparoscopic prostatectomy?
That's a great question. Thank you. The results are probably fairly similar in expert hands. There in the average prostatectomy, I bet you the laparoscopic prostatectomy, and I don't bet you because I know the data, is exactly the same as robotic prostatectomy. But like I mentioned earlier, we're a dying breed that know how to do this laparoscopically. Everybody is coming out robotically trained in the prostatectomy. So their ability to learn laparoscopic surgery is diminished all across the world. And second of all, there have been a few times where I've been doing surgery laparoscopically, and there is a difficult to reach blood vessel around the side, or the prostate's extra large, and I just can't get underneath it with my straight instruments. I have to come underneath and over. That I wish I had that little wrist inside the body. And so for the average prostatectomy, I would say that it's probably equivocal which instrument, which technique you use. But there are certainly a lot of cases where I would there are certainly a number of cases where I would have rather had a robotic. The other thing is that there are a lot of surgeries right now that we would not dare to do laparoscopically. That when the robot comes, we'll be able to do much more of. Dr. Wong is trained in robotic cystectomies, which is taking out bladders for bladder cancer, and he would be able to offer that to a lot of the patients instead of an open surgery. Also, retroperitoneal lymph node dissections for testis cancer. I think, again, a surgery that I would never dream of doing laparoscopically because the angles and the movements are so intricate, but robotically we can definitely do it. So it will extend our ability to do a lot more different types of surgery, and certainly the more difficult prostatectomies, I think it will allow us to have more consistent outcomes in those more difficult prostatectomies.
Wonderful, thank you. Another question from Gloria. Will cardioablation surgery be robotic?
That probably will not be. I mean, technically you can do I could do a circumcision robotically, but the cost benefit ratio probably doesn't fit. And I don't think like a cardiac ablation surgery will probably still be one of those things that they can do without the robot.
Alf, I see you've got your hand up. If you could just type in your question in the Q&A at the top left of the screen, that would be wonderful. Speakers have been disabled, so we won't be able to hear your question. Please type that in. And we've got another question in the meantime from Kimberly. When you talk about robotic surgery, laparoscopic surgery is not included in that category, correct?
Yeah, so yes, robotic surgery is basically, it's also laparoscopic surgery if you think about it, but it's a robotic assisted laparoscopic surgery, as opposed to laparoscopic surgery where we're standing by the body using instruments with our hands. The robotic arms are use the instruments that are placed into the body, and whatever we do in a console, you actually, if you look at how this works, you stick your two fingers in these rings, and you stick your head in a 3D glasses, and whatever you do with your fingers, the robot does within the body. And we can bend our wrists outside in these rings, and the robot will do that in the body. And the fidelity or the trueness of the movements that what I do compared to what the robot does in the body is like bang on, spot on, right?
Great. Another question, and we do have room for more questions if any folks want to go ahead and type those into the Q&A. Do robotics benefit all disciplines of surgery?
To that answer, I would say probably there is potential. There's potential, but robotic techniques will have to be developed. And it's not, some effort would have to be developed, put into developing robotic techniques in that discipline of surgery. For example, I don't think it probably would help obstetrics. I think C-sections should still be done open. I think in cardiac surgery, I think a lot of things are still probably better done open as compared to robotics. But in disciplines such as general surgery, abdominal surgery, pelvic surgery, female and male pelvic surgery, I think the benefits have been proven, and there's a good track record, and those ones are probably where it's been most established. And like I mentioned earlier, ENT is not as far advanced as urology in their robotics journey. Their techniques are probably a little bit newer and still being worked on. But having said that, I see huge potential in ENT, ears, nose, and throat surgery in the future with robotics.
Great, thank you. And what is the cost for these robots?
Yeah, the costs are obviously quite a lot. The robot, I mean, there are different models right now. Like you can buy it outright, and then you just pay for a yearly kind of maintenance fee, plus every surgery you have about $3,000 to $4,000 worth of disposable items. So if you were to buy it upfront like that, the Da Vinci robot, which is the one that we really like, because they have indication for ENT and thoracic surgery. That one will probably go for about $4 million to buy it upfront. The Medtronic, which is also an excellent robot, you saw a picture of my son working on the Medtronic robot. They're a bit of a newer robot, and unfortunately, they don't have indications for ears, nose, and throat and thoracic surgery. So, but their robot's a bit cheaper. It's probably about $3 million for that robot. Upkeep costs are probably about 200,000 a year, and then instruments about $2,000 to $3,000 per case. But there's also a pay-per-use model for these robots where they'll upkeep it for you. It's like a lease, and depending on how often you use the robot, which one's more financially better, there's a place where it intersects, right? So that has to be calculated out. But yeah, we're talking significant cost. Maybe not as much as one of those heart valves. One of those heart valves that we pay for upstairs for cardiac surgery costs about $30,000, and some of those venous grafts that we use in vascular surgery, those are up to $60,000 for one patient. So robotics is not that much, but it is a bit more definitely than what we're doing now laparoscopically.
Okay, and this sounds like it might be an internal question. Staff are asking, is the cost center for the robotics program separate from the main OR, i.e. is it its own program with funding?
That's a good question. Somebody with knowledge asked that question. Yes, actually, our region has really stepped up. Fraser Health has really stepped up, and we're not just in a lot of hospitals. The robotics program, the robot is just being used as an instrument for surgery. But in Fraser Health, they've really stepped up. They're organizing into a whole program where we have directors and managers, we have quality control measures, we have research that we're doing in the robotics program as well. It's becoming a real, it's growing wings on its own, and it's an exciting way to envision this program for sure. So, but yeah, it comes with its own. It's supposed to come with its own funding.
Great, thank you. Let's take one more look. It looks like that brings us to the end of our time together. So again, thank you so much, Dr. Yang. That was so great to just learn so much of what's been part of your life over the last several years. And we're just really grateful to you and your many colleagues for your expertise and your dedication to this work. And of course, thank you to the donors that make projects like this possible. We couldn't do it without you. And thank you to our audience. Thank you everybody for joining today, for your interest, and please share what you've learned today. I think we need more hope and excitement to look forward to. And we will be sending out a recording after the session is over, so feel free to share that along. And to learn more about Royal Columbian Hospital Foundation, please visit our website, rchfoundation.com, and do get in touch if you'd like to get involved in any way and learn any more about what the foundation does for the hospital. So thank you, and we will see you next time. Bye for now.